going to give a little quick introduction to Jessica, who is our ASL interpreter. I'm also, before we start formally, going to invite you to have a look at your chat function, which you can see at the bottom of your screen typically. And we are already inviting you to let us know where you're joining us today. And because wherever I travel, I bring bad weather, feel free to brag if you've got lovely weather where you are. Because no matter where I travel, I seem to bring the cold and the rain. All right. So welcome to today's conversation on improving equitable access to assistive technology. This is near and dear to my heart. As my mother uses assistive technology, I use assistive technology, and my daughter uses assistive technology for a variety of mobility reasons, hearing reasons, vision reasons, and we'll ask you a little bit more about your use of assistive technology in a minute. But most importantly, let me start off by acknowledging that although we're meeting virtually and I can see across this entire country, I want to acknowledge that we operate on the traditional territories of many Indigenous nations, which have cared for the land for thousands of years, including the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I recognize the current treaty holders, the Mississauga of the Credit First Nation. This land remains home to many diverse First Nations, Inuit, and Métis peoples, and is subject to the dish with one spoon wampum, which is an agreement to peaceably share and care for the Great Lakes region. I'm grateful to have the opportunity to work on this land today. You may live and work and play in different territories, so we encourage you to reflect on the land in which you're located, and feel free to share that if you would like in the chat. Consider your relationship to the land and to the people who are the traditional keepers of that land and whose wisdom we will be building upon today. You can see that I'm speaking a little bit more slowly. Again, I wanted to thank our ASL interpreters to make sure that we have full accessibility. You will also see that there's the availability for subtitles and transcripts. We're going to ask you to engage in a wide variety of ways. We're going to have interactive polls. You're going to make sure that this webinar is recorded. It's going to be made available broadly on AgeWell's YouTube channel and then through many of our partners as well. We'd love you if you feel comfortable to be very active in the chat box. And for the questions that you specifically want us to include, you can use the Q&A function, but we will also be monitoring the chat box. Sydney is our chat moderator for today. If you've got any technical difficulties, please contact Nicole. Her information is on the chat as well. If you get lost, you can always throw a question in the Q&A saying, help, I need technical assistance, and we'll also make sure that you get any assistance that you need. So let's kick things off first, and I am going to bring our first speaker to introduce herself and to help frame today's conversation at a global level. Kylie Shea is from the World Health Organization, and she's been very busy, not just generally during COVID, but in particular getting major reports out the door from the WHO. Kylie's been a leader in assistive technology at the local, regional, and global levels for many years. And I'm so excited to turn over this presentation to her and to let us know a little bit about what's been happening with the WHO report on assistive technology. Kylie, over to you.
Thank you very much, Laura, much appreciated. And it really is an honor to be invited to join you all for this conversation. And I would like to start by congratulating March of Dimes and AgeWell and I'm just adjusting my screen here, and CanAge, on what I understand is a very strong and productive network, which has helped to shine a spotlight on the importance of access to quality, appropriate and affordable assistive technology for all, and in particular for people who are aging. So I am a member of the assistive technology team at the World Health Organization at our headquarters in Geneva. At WHO, we are very clear that assistive technology is an integral component of a comprehensive healthcare system, and that it plays a critical role in ensuring the well-being of people throughout their life. As an occupational therapist, I've been involved in international development with a focus on strengthening in low-income countries the systems that support access to assistive technology for over 30 years. And in these years, I've seen a gradual shift, which is really only now gaining momentum, of assistive products being seen as special devices many years ago, and not in the not too past and not too far away past, but as special devices used by the minority and mostly people with disabilities. To the point we are now where there's growing recognition that assistive products are in fact a means of enabling anyone, anywhere with a functional impairment at any age. So this is not just a disability issue, it is about all of us. And so to illustrate, I want to bring to this topic my own personal perspective as a daughter supporting parents who are aging. So the photograph that's on the slide now shows my 94-year-old father and 83-year-old mother. My father in recent years has experienced a gradual decline in his function, and every step of the way, assistive technology has been there to assist him. He's always worn glasses. However, as his hearing began to fail, hearing aids were the solution. Having had prostate cancer, and as he has become more frail, my father now relies on washable absorbent products to contain leaks and to maintain his dignity. You can see in the photograph that he is using a walking cane and he has grab rails in his bathroom. And most recently, the shock of learning that his driving license would not be renewed was lessened by the motorized scooter that you see behind them. So our hope as a family is that with the support of assistive technology, good healthcare, aged care services, my parents can continue their lives together in a home they love. And from that personal story, I'd like to share with you a much bigger, more global picture. And that brings me to the global report on assistive technology. So yesterday was a momentous occasion for our team with the launch of the first ever global report on AT. It was requested by member states through the 2018 World Health Assembly resolution on increasing access to assistive technology. And this report presents for the first time a global overview of the status of assistive technology, and it places increasing access to assistive technology firmly on the agenda. I want to take just a few minutes to present some of the data from the report, which has particular relevance to your conversation today. So for the global report, WHO developed a household survey tool called the Rapid Assistive Technology Assessment. 29 countries participated in population representative surveys, gathering data from over 300,000 participants. And this information has informed a new global estimate of the need for assistive technology. So we now know that at least 2.5 billion people today need assistive products. And by 2050, we expect that to grow to 3.5 billion. And this is significantly higher than the previous estimate of 1 billion. And the growth, we all understand, is associated with a global aging population, as well as increasing prevalence of non-communicable diseases, which have a significant impact on people's functional abilities. In terms of the prevalence in relation to aging, the data from the 29 countries provide us with a very clear message, which I don't think is news to anyone on this call. People in the 60+ age group are more in need of assistive products than younger groups. And in fact, 2 in 3 older people need at least one assistive product. The graph on the left of the slide, which is a little tricky to read possibly on some screens, clearly illustrates the trend in relation to need, with the older population groups shown at the top. And on the right, we can see that from a global perspective, access to the products that people need clearly increases for all age groups, for people living in countries with a higher human development index, which is one measure of the global inequity that we can see through the data in relation to access to assistive technology. So the data that I've just shared here is just a snapshot of what is in the report. And that in itself is also just a subset. So the data is rich. And so for people that are interested in digging deeper into this, we've launched the Assistive Technology Data Portal on the WHO Global Health Observatory. So on the slide there, there's a picture of that repository. And at the end of this presentation, I'll drop in the chat the link for people who are interested. So some of the country level data that's been gathered and used for the report is there now, and we'll be continuing to build the data set over time, and it's publicly accessible. We also strongly encourage countries to consider using the RATA tool that we developed to undertake national level population-based surveys, so we can increasingly demonstrate and understand the need. So I'm going to finish with just one final slide, as I realise that today is an opportunity for Canadian stakeholders to come together to discuss a possible way forward in increasing access to assistive technology in your country. And therefore, I just would like to touch briefly on systems. So many of you may already be familiar with the 5 assistive technology Ps, which we use to provide a framework for successful access to assistive technology. We need, working together, a system-oriented approach with the people who use assistive products and their families at the centre. Affordable products, effective provision systems or services, trained personnel who can assist assistive technology users to select and use the products that they need, and we need supportive policies. For the global report and for ongoing self-monitoring by WHO member states regarding their progress in increasing access to assistive technology, 70 member states, including Canada, responded in 2021 to a survey around 10 progress indicators. And as the figure on the screen shows, the results from this survey highlight that the biggest gaps in system preparedness are in training and education on assistive technology for health and other personnel, in having enough personnel able to provide assistive products and assistive technology services themselves. And this tells us where some of the greatest work lies ahead. And this is not unique to low-income countries. This is across the board. And so in closing, I encourage you when discussing building on your existing assistive technology systems to strengthen access, to continue to network as you are, to draw in all relevant stakeholders, to work across sectors rather than in silos, and to consider adopting a framework utilising the 5 Ps so that no piece of the puzzle is missing. Thank you very much for having me talk today.
It's such an exciting time, and congratulations on this report. It's going to make such a difference for everyone just to have that data at their fingertips. I was already writing down and putting snapshots of that in just to see the degree of expansion of the need and use of assistive technologies is going to be incredibly helpful for us in Canada as we start to move forward, as Sheena was saying in the chat, looking to take this to the next level. So congratulations from all of us, and thank you. We're just thrilled with the, I know, enormous amount of work that went into this. So thank you, Kylie. It's now my great pleasure to introduce to the stage a dear friend and really a national and global leader in this space, Dr. Alex Melidis. Alex, I wanted to ask you about the Canadian perspective on this issue, and maybe speak a little bit about how AgeWell is not just meeting this challenge, but really leading in this challenge.
Yeah, great. Thanks very much, Laura. And I also want to give my congratulations to Kylie and WHO on their report. It's been a long time coming and a lot of work on their part, and it's great to see that final product. So, before I get into some of my slides and my discussion, I will just give a quick introduction to myself as well. And I like how Kylie has provided us some personal examples, and I think I will do the same just to really set the stage here. So, as Laura said in her very kind introduction of me, my name's Alex Melidis. I've been a professor and researcher in the area of assistive technology for older adults for almost 25 years now, if you go back to my grad school days. And my primary area of research is in the role of more advanced technologies, as I'll talk about, to support older people and their caregivers in their own homes and communities. I'm also the scientific director and CEO of AgeWell, which I'll talk about in a second. AgeWell being the largest network here in Canada and most likely around the world of researchers and partners in this particular area. Personally, I'm also a person who uses assistive technology. I suffered a incomplete spinal cord injury about 2.5 years ago from a fall, which has led me to use a whole variety of assistive technologies, over that time period and currently now. I'm also a caregiver to my parents, who are also both in their late 80s, and with my mother now in the early stages of dementia. So again, a lot of the work that I do now is I'm using it in real life, which is wonderful, but also sometimes a bit discouraging to realize that as a consumer of my own work, sometimes the poor job we have done in the assistive technology marketplace in Canada. So with those words of encouragement, can you bring up my slides, please? I think it's Nicole in the main office there. Thank you very much. So as I mentioned, it's gone. Can it come back up, please? Wonderful. So as I mentioned, one of my hats I wear is a scientific director of AgeWell, which is a network of center of excellence. And so this is a program that has been funded through the federal government through 2015 till now. And the whole goal of this network of center of excellence was and still is to bring together the best and brightest from across all different disciplines, and to really break down those silos that Kylie was talking about in order to develop the best solutions possible with respect to new assistive technologies to support older people. So as you can see from this slide, we are quite large. We have over 1,000 researchers and trainees, or what we call highly qualified personnel. We have 46 universities and research centers involved from coast to coast to coast here in Canada. You see a breakdown here of the different types of partners we have, from 139 industry, 85 academic, and so on. One of the exciting things that we do is we don't only support research and development in this area, but we try to actually get product out there on the marketplace and in the hands of the people that need them. That is older adults and people who are aging with a disability, as well, as we're seeing more and more these days, obviously. And so we've supported now 56 startups here in Canada, which we're proud to say are staying in Canada, and some of them are actually starting to make money, which is a great thing to see from the startup itself. Next slide, please. So as I said, AgeWell was launched in 2015 through the federally funded program, the Networks of Centers of Excellence. And we cover a wide range of complex issues when it comes to assistive technology and aging. And this is including research across disciplines. I think one of our latest counts is we're well over 60 different disciplines that are involved in our network and in our R&D activities. Obviously partnerships across sectors. And so it's really important that we look at sectors, including not just industry in the tech sectors, but government, policymakers, not-for-profits, et cetera, NGOs like the WHO, and we've worked with them in the past as well. A big aspect is training the next generation of people who will be developing these new types of assistive technologies, but also training people who would benefit from assistive technology as well. And so that is developing training programs for older adults and their caregivers and families and part of their care teams as well, so that they understand exactly what's going on and how assistive technology can play a role. The final piece here is, a big aspect of what we want to do is putting evidence into practice. And that's a real critical aspect. And we want to ensure that everything we do is evidence-based. And you're going to hear from some of our great researchers in a moment, Dr. Rosalie Wang and Dr. Michael Wilson, who have collected some outstanding evidence around the notions of equity in terms of assistive technology in older adults. And that is all based on research that we have funded along with other partner organizations across Canada, including CanAge and Laura, as she described CanAge at the start of this presentation. Now, this last point here, I'm not going to spend a lot of time on. This is really just to say that, and many of you are part of the AgeWell community who are listening, that you all know that the NCE program and funding has been ended by the federal government for some reason. But AgeWell will continue well beyond this mandate, that we have already set up plans for AgeWell to continue to be positioned significantly within the age tech or assistive technology sector for older adults, and that we're going to be expanding our work with a specific focus on implementation. That so many great solutions have been developed by our network, and if you want to learn more, maybe someone can just pop the website into the chat for everyone. But you'll see all the type of work we're doing, and at this point, it's now time to scale and to sustain this work, and again, to ensure that current and future older adults in Canada are receiving the supports that they need with respect to assistive technology. Next slide, please. So as I mentioned, we are building on our momentum and establishing ourselves beyond the NCE period. So for example, we just received new funding from the Canadian Institutes of Health Research, or CIHR, to expand our training program, which is called Early Professionals Inspired Careers in Age Tech. And again, this goes back to what I was talking about before about training the future leaders, but also training the users of assistive technology as well. We have been identified as a strategic initiative of the University of Toronto with a national scope. And so again, that will give us support from the University of Toronto and their various partners to continue to build our work. We've developed further partnerships, for example, with an organization called MedTech Plus in Quebec that works in the medical devices field. And with them, we are just waiting to hear about the results of a grant to the federal government to set up something called the Quality Aging Program, which, if successful, will help us to set up more than 20 implementation and test sites across Canada in order to implement and test and understand how well the assistive technologies that we're building actually work. The final thing we're waiting to hear back from as well from the Canadian government is a partnership with the Canadian Frailty Network, because frailty is such an important issue in aging, and assistive technology can play such an important role in helping to reduce the potential implications, which are often catastrophic, of frailty. And if successful, our two organizations will be setting up a new umbrella organization called Healthy Aging Canada. So again, stay tuned for all these potential outcomes and new programs that we'll be developing. Next slide, please. So again, this just says join us. We welcome everyone to, again, stay in touch with us and to understand what we're doing. And at this point, you can turn off my slides, and then I'll just finish off by talking a little about assistive technology in Canada here and the current landscape. And the landscape in Canada really is not that much different than it is in other countries. We have our own unique challenges, for example, of ensuring that we get assistive technology to the north, to remote communities, to Indigenous communities, understanding how multiculturalism impacts the design, the development of assistive technology. And I'm sure you'll hear more about that from Dr. Wang and Dr. Wilson when we talk about equity in assistive technology. But overall, again, the landscape in terms of the percentages and the numbers are quite similar to what you see in that WHO report itself. When we think about assistive technology, though, we often think of the typical things for older people, like grab bars, those awful mint green walkers that we always see everywhere, and different types of mobility or environmental devices that help older people to get around. And those assistive technologies are still obviously very, very important. But what we're seeing in Canada and around the world, in particular what AgeWell is doing, is really now pushing the envelope of what the definition of a classical assistive technology is. And if you visit our website and see the projects we're working on, you will see that we are also now including in the assistive technology definition things like smart home systems. So technologies that can help older adults with dementia, for example, to complete their activities of daily living by understanding using sensors and artificial intelligence what the person is trying to achieve, and then giving them the support, perhaps through reminders and guidance, just like a caregiver would. You will see that AgeWell also is investing in several projects around assistive robots. So robots in the home that, again, can assist older adults with their activities and their self-care activities, and even things like socialization and helping them to be connected to their communities, to their friends, family, to their healthcare teams. And this is, again, really critical because while typically we have not thought of things like artificial intelligence and robots and sensors as assistive technology, they really are. And in a way, they're becoming the assistive technologies that we're seeing being sought after more as we start to see a new demographic and a shift in our older adult population and in our caregiver population as well. And I think that'll be the final thing that I'll just finish on is, in this whole discussion, we cannot forget the caregivers. While the classic definition of assistive technology focuses specifically on people with disabilities and some new definitions on those who are aging, assistive technology can also be used by the caregivers. It can help them to overcome limitations that they may have, whether it's because they have their own physical or cognitive disability, or because there's social factors that are involved, such as their own families and children they're looking after, where assistive technology can help them to overcome those impediments that may be placed on them because of those factors to provide the best care possible. So as we move forward here, I really hope that we have a very holistic and a very cutting edge discussion about what assistive technology is and how we can move it forward. So I will stop there and hand it back to our wonderful host, Laura. And I'm not sure if we're doing questions or not, or if we're moving on really to the true talent today.
Yeah, so I'm going to invite Michael to the stage, and then after Michael, Dr. Rosalie Wang. So I'm so delighted to introduce next to you Dr. Michael Wilson. Some of his research was highlighted by Alex just a moment. He's an associate professor at McMaster University, and he and Rosalie have been doing some absolutely cutting edge work. We're so delighted to have you here, Michael, to share your wisdom with us. Over to you.
Great. Thank you very much, Laura. Thanks for having me. So I'm just going to cover a few quick slides and then turn it over to Rosalie. Our project focused on enhancing equitable access to assistive technology in Canada and was comprised of a number of different studies that we used to build and propose a vision for enhancing equitable access in Canada. So next slide. Okay, so our two main goals for our project were to examine how assistive technology is accessed by Canadians to identify funding and service gaps, and then also to explore ethical issues on equity of access. And then importantly, to work with citizens, both those with and without lived experiences and caregivers, policymakers and other stakeholders and system leaders to support the development of policies that can improve access in a fair way. We did a number of interrelated projects that really focused on addressing what is a very complex policy issue. And to work on these kinds of really complex policy issues, you need the interplay of evidence on the one hand, and ideally the best available evidence, and then pairing that with citizens' values and preferences and the experiences and insights of those system leaders and frontline people working at the front line. So what we did was a jurisdictional scan of all of the programs, government and charitable programs across the country that provide access to assistive technology in Canada, convened a series of citizen panels across the country, people with and without lived experience, caregivers, and people who are ethnoculturally and socioeconomically diverse to identify their values and preferences for how to enhance equity in assistive technologies. And then we convened a national stakeholder dialogue to identify what actions can be taken in this policy area. We heard a lot of things, and then we ended up doing some follow-up work to do some more interviews, and then a final deliberative dialogue as well after that. So next slide. What we heard across all of these projects were these were the big picture challenges that we heard about. And the first is that there's system level complexity. The complexity can make access to and navigation of programs and services really challenging. People have to navigate across over 200 different programs across the country, so it makes navigation very hard. The values and principles guiding our current policies and programs aren't always aligned with those of citizens who can use or benefit them, who need to prioritize enhancing their function and flexibility in those programs to meet their unique needs. We also found that a key challenge was that policies, programs, and practices are not keeping up with increasing need for assistive technology, but also the rapid pace of technology advancement. If you have programs that haven't changed in decades, but a rapidly changing innovation area with assistive technology, that means that the programs aren't keeping up with what's out there. And then lastly, there was a lack of a guiding policy vision to support actions in this area across the country. Next slide, and then I'll turn it over to Rosalie. So in our final dialogue, we talked about developing and implementing a policy vision for enhancing equitable access. This was the big action that was suggested from system leaders across the country who said that fundamental change in an approach was needed. And they affirmed the need to create a national strategy. They saw that as important for fostering national leadership, cross-jurisdictional coalition building, and building supports, but also making sure that decision-making involved many people, including innovators and vendors, consumers and health providers, and then also the need to reduce stigma through public education. So I think I'll end there and turn it over to Rosalie.
Thanks very much, Michael. Really exciting work to do. And I'm delighted to introduce Rosalie to the stage. Dr. Rosalie Wang, over to you.
All right, great. Thank you so much, Laura and Mike. And thank you everyone for joining us today. I am thrilled to be presenting a vision for assistive technology access in Canada that's created with the input of all of those that Mike has already described. So people who use or may use assistive advocacy groups, clinicians, professional organizations, health and community care providers, industry members, and policymakers. So we hope with this vision, it'll serve as a blueprint for further nationwide discussion and form the basis for a national strategy for enhancing equitable access to assistive technology in Canada. So what we envision through this possible body of work is that Canadians have equitable access to assistive technology products and services, and that equitable access to assistive technologies and use of assistive technologies, especially within an accessible environment, helps Canadians of all ages and abilities to live dignified and meaningful lives, achieve their goals, and to be contributing members of society. So I will begin by highlighting the top 3 priority issues to address in the National Assistive Technology Strategy, the 2 main principles to underpin policy actions, and 3 short and 3 long-term goals as determined from our collective research activities. So the top 3 priority issues to address is the unclear definition of assistive technology. So medical device, durable medical equipment, assistive device, assistive product, adaptive aid, disability support are all terms that have been used previously in legislation, policy documents, and program and service descriptions. And so the unclear definition causes a lot of differences in how things are allocated and potentially what is eligible to be funded and what is not. The other priority issue to address is the barriers to access that are driven by financial barriers, complex system navigation, which Mike has already mentioned, and the complex choices that are faced by consumers. And the last top priority to look at is the lack of focus on environmental accessibility. So the 2 main principles that came up from our collective research to underpin a policy vision and any policy actions moving forward are use of a human rights-based perspective, which states that everyone is entitled to equality, dignity, respect, and freedom from discrimination. And the second principle to underpin policy actions is the use of a person-centered and co-creation approach to identify challenges and create solutions together. So for our short-term priorities, which ideally would be achievable within 1 to 2 years, is to adopt a common language for assistive technology across Canada, including an agreement on one accepted definition, to be able to streamline the consumer experience to make it easier to navigate the programs and services for assistive technologies, and to be able to minimize coverage gaps and financial burden on consumers by better coordinating publicly funded programs and private insurance. And finally, for the long-term priorities, achievable potentially within 4 to 5 years, is to make access to assistive technologies fair for people who often face the biggest challenges, ensure the environments are designed to be accessible by people of all abilities, and that these goals are consistently supported through public policy, and also to improve knowledge and skills of all professionals who are involved in the assessment for and provision of assistive technologies. So from events such as this one today, we hope to reach more Canadians who use or may use assistive technology and who have an interest in enhancing equitable access to assistive technology in Canada. So with the creation of a national strategy, it can help to define our vision and policy directions and address the challenges impacting fair access to assistive technology. Strategies are often used to tackle complex and high priority issues that cross sectors and break down silos such as health, social care, education, and employment. So strategies can provide better guidance for a consistent and balanced approach for how we allocate our resources to ensure future sustainability. But even more importantly, they can be co-created in a way that unifies diverse groups and through shared goals and values and a common or agreed upon actions and outcomes. And so for the next stages of our work here, we are looking for champions to lead the next steps and to be able to convene a national coalition that includes all of the stakeholders who have been involved through this process and anybody else who has an interest in improving equitable access. So the coalition may develop the blueprint into a strategy to define work processes that includes the principles that we've defined and map action plans to address the top priority issues and the short and long-term priorities. And the coalition may also look to explore some of the opportunities for aligning with synergistic policy initiatives and leading change. That is all for our brief overview of our vision. And I'm just leaving you with our system navigation website that we created with research resources and funding from AgeWell, accessassistivetech.ca. So thank you.
Thanks very much. This is such an exciting day to hear about the fantastic reports and work that you and Michael are doing, that Alex is doing, and of course that we're seeing Kylie do at the World Health Organization. We're giving you just 5 minutes. So answer the door, get the Amazon guy, let the dog come out, grab a cup of coffee, but that's it. So don't go anywhere. We're just giving you a few minutes in the break. 5 minutes. So we will see you back in 5 minutes. And I'm going to stay right here. And we're going to start off with our next speaker, Len Baker, President and CEO of the March of Dimes Canada, and our fantastic panel discussion. 5 minutes, everyone. See you then. Giving you all a 2-minute notice. So 2 more minutes, stretch your legs, do a little bit of a back rotation, and we're going to start again in just 2 minutes. This is your 60-second notice. We'll be coming back to you with Len Baker in 60 seconds. Again, feel free to use the chat or the Q&A at any point. We're pretty active in them and love to hear about the great work that you're doing, needs that you're seeing, or any kind of trends that you'd like to share about. The chat is as rich a conversation, I think, as anything else that we're doing today. So just 1 more minute. Welcome back, everyone. We're so pleased to have you back. This is the second part of our fabulous presentation talking about assistive technology, and we're really privileged to have the incredible panel and speakers that we have today. I'm so delighted to kick off this panel by introducing to you Len Baker, President and CEO of the March of Dimes Canada. And Len, this is an issue near and dear to your heart, I know, and we're excited to hear what you have to say. Turning it over to you, Len.
Well, thank you, Laura. I hope you can hear me okay. It's wonderful to have the opportunity to be here with this very esteemed group of professionals and people interested in the important discussion around assistive technology and what it means for people living with disabilities in Canada. As Laura mentioned, I'm the President and CEO of March of Dimes Canada, a leading organization providing services right across Canada to people with disabilities. I'd like to thank AgeWell and CanAge for including me and March of Dimes Canada as a partner for today's event. I'm really proud to be here. As Laura mentioned, this is an important topic, not only for March of Dimes Canada, but certainly for people living with disabilities and an aging population of Canadians whose lives can be enhanced and supported through access to the correct technology and devices to help people meet their needs. March of Dimes recently released a new 3-year strategic plan, proudly entitled Champion Equity and Affordability. Nothing ambitious there at all. That focuses on helping children and youth to have the best start in life, creating independence at home and in the community, supporting people to live active, healthy, and connected lives, and enhancing financial security for people living with disabilities. The latter one is very important because we know that far too many people with disabilities are simply trying to scrape by and survive instead of being able to flourish and thrive. And increasingly, we know technology is a key enabler. In developing our new strategic plan, we spoke with over 1,000 people in our community, members impacted by disability. Nearly 3/4 of them told us that technology allows them to be more independent. More than half said that the most valuable technology for living with their disability was a smartphone, tablet, or smartwatch, followed closely by a mobility or agility aid or devices. But more than 50% of community members also said that barriers such as the cost of technology or lack of knowledge about how to use it prevents them from using the technology they need. As Michael mentioned, we also know that navigating through a complex system is a major source of frustration. On the issue of cost, we know that access to technology is no longer a luxury. It's become a basic human need. And today, technology is how we access services, experience connections with others, and live, work, and play. But there's a very real digital divide, particularly when people with disabilities are twice as likely to live in poverty in this country. The expense associated with technology becomes a significant barrier. On the issue of knowledge, again, there is a real barrier. It is one thing to have the technology, but another to understand how to unlock its potential, and especially to make that technology accessible based on a person's unique needs. That's why last year, March of Dimes Canada partnered with TELUS to expand the Tech for Good program nationally. Tech for Good provides people with disabilities direct access to assistive technologists at March of Dimes Canada. Our team provide personalized, virtual, one-on-one assessment, assistive technology training, and recommendations based on participants' individual needs. And you'll hear more from Alison Edwards in the Catalyst conversation coming up about her experience with Tech for Good. It's important to underscore that the program is primarily educational in nature. Understanding the landscape of assistive technology, analyzing the options available, and determining the best solution for an individual requires specialized knowledge. People with disabilities already have so much to navigate on a day-to-day basis. Navigating the complexities of assistive technology options should not be one more barrier to contend with. So that's why we're proud to partner with TELUS on the Tech for Good program. It is one step on a journey towards equitable access. Of course, there are many other steps we need to take together. I have very much appreciated learning about the important research taking place nationally and internationally on the current state of assistive technology. This evidence base is painting a clear picture. It's crucial that we connect across our organizations, communities, and sectors to advocate for greater equality. The voices of people living with lived expertise are always the most valuable in shining a light on how policies play out on the ground. And March of Dimes Canada will soon be launching a new advocacy network for people with disabilities, equipping our community members with the skills, resources that will foster their ability to effectively advocate on pressing issues from access to assistive technology to increasing financial security. We know that when many people speak in unison in many different places, many small changes happen. And together, those small changes can become big ones. For this reason, I'm honored to kick off the second half of today's event to hear directly from the community members with lived experience of using assistive technology. With that, I turn things back over to Laura and the panel, and I look forward to sitting in on the discussion. So thank you for having me, Laura.
Thanks so much, Lenny. Congratulations on your strategic plan. Your passion and dedication to this area is a real inspiration to us all. But our next inspiration is going to be coming from our wonderful 3 invited panelists. Again, people with lived experience who are using assistive technology. I'm going to invite them all to just join on the screen at their convenience by clicking on their cameras. The first person I have the pleasure of introducing is Alison Edwards. She's a blogger. She's a member of the March of Dimes Tech for Good program, and she's a real inspiration to all of us in the incredible work she's doing. I'm also going to introduce to you on the screen Era Abraham. She's the CEO of Listen, and we'll hear much more about that great work when she introduces the organization. And last, we're delighted to introduce Carrie Anton. She's the accessibility advocate and the CNIB National Board member, and she's going to share her expertise and experience with us today. So I'm going to turn it over to the panel, and if there's any volunteer that would like to go first, I'll let you do that. Otherwise, I get to choose. Alison, I'm looking at you. Would you like to kick it off?
Absolutely. So can everyone hear me okay? Great. So good afternoon, I'm Alison Edwards. This is surprisingly my first Zoom event ever. So I'm brand new at this, so I'm going to be referring to my notes. So here is my story. I was diagnosed with MS 8 years ago at the age of 45, slow progression for the first 4 years with a gradual loss of mobility. Then I was having numerous relapses a year. So I underwent a stem cell bone marrow transplant at Ottawa Hospital 3 years ago in 2019. Complications from the high doses of chemo resulted in a broken hip. I have lost mobility in my legs and require full-time care. I live with my husband, Ken, who is my caregiver. Due to isolating after my transplant, COVID restrictions, and then my mobility decline, I'm now homebound. We have made the 2 rooms I live in comfortable, inviting, and a space where I am creative in. Professionally, I was a kindergarten teacher and a part-time online professor with Loyalist College for their early childhood education program. Ironically and appropriately, I taught a children with exceptionalities course. So that's a bit about me. I would like now to share my thoughts on some challenges. First, access to funding is to me one of the biggest challenges. And this was really explained well by Len Baker in our introduction. So I'm going to focus on 3 others. One challenge I find is isolation, compounded by COVID. But even so, the elderly population and individuals like me that are homebound, we feel isolated and can find it difficult to acquire technology, but also is access challenges. And how I would explain this is that you may need support to actually have a device, but then you have to have access to the internet. You have to have the ability and the knowledge to be able to access suitable supports. And the final challenge that I find is language barriers. And what I mean by that is that I think it's really important that professionals and organizations are talking to the participant using appropriate language. I find organizations, and I found this very much in education, that organizations have their own lingo and vocabulary. And as clients or as participants, don't know. For example, when I was first being diagnosed and I was going through the process, acronyms are really hard to navigate. So for example, ADP was thrown out many, many times. And unless you know the acronyms, it's hard to be part of the process. So those are the challenges I have faced. So that's it, Laura, for me.
Thanks so much for sharing that and sharing your story and your diagnosis. It is interesting how your life experiences as a teacher and a person engaged in pedagogy has informed your whole life course as well. And thank you again for sharing your journey with your husband in that care relationship. And I know that your creativity is flourishing. So thank you again for that. And I'm going to bring
I'll talk more about that later.
Absolutely. I'm going to invite next Era Abraham to the stage. And so I will invite her to unclick. And Alison, if you want, you can close your camera for the moment. We'll give you a little break and invite you back to the stage for the group. Over to you, Era. Thank you.
Yeah, thank you very much for having me here, all of you today. So my name is Era Abraham, and I'm the founder and CEO of a company called Listen. And Listen, basically, we're developing an application to help people who are deaf and hard of hearing gain awareness to sound around them, and that require their immediate attention. So I'll give you a little bit of background on why I started this company. I actually started it because I am hard of hearing myself. Many years ago, I had living in a condo building in Nova Scotia, and I had slept through what was a routine fire drill. And I only found out about this fire drill a couple of days later, where the property management company, they sent letters and give an explanation of incidences that had happened in the building a couple of days later in the mailbox. And I was quite surprised. At that point, I always thought that I had the hearing capability to hear loud tones like fire alarms. But when I realized that I needed assistive technology to help me through that experience. So I went and started looking for assistive technology and came across a number of challenges navigating this space. And one of them was really the idea that the regulations that are designed to help people who are deaf and hard of hearing with the fire alarm is not consistent across the provinces or the states or different countries or even the building, depending on the building code. And so that means that a lot of people who are deaf and hard of hearing have to purchase alerting devices for themselves. But the other challenge that I came across is we started purchasing devices that were made in the US, made for the US market. And if you're unaware that the tones of fire alarms are not the same as what it is in Canada. So my assistive device that I purchased all the way from the States no longer worked. And I thought, there's got to be a better way. And this is where I saw the opportunity of using artificial intelligence to really help drive the new advanced technologies for people who are deaf and hard of hearing. And so I'll end there, and I'd love to talk about other challenges as well throughout the conversation and solutions and what I see for the future of assistive technology.
Thanks so much, Era. We're delighted to hear it, and your company is so exciting. Can't wait to learn more. Carrie, over to you. I'm going to invite you to come to the stage and excited to learn more about your work on accessibility and technology.
Thank you, Laura, and I'm so happy to be here today. Obviously, I'm in the right meeting because this is about assistive technology and some of the systems barriers and challenges that are out there, and a lot of the user experience and lived experience. Myself, I've been legally blind since birth, and I went through school and university. I took a Bachelor of Arts in Sociology and Criminology, so I wanted to work in law enforcement. but technology keep pulling me back. And so now, after decades of working in the assistive technology industry, there's no way I could do without it. I am on many boards, as Laura mentioned, National Board of CNIB, but I'm also work at Athabasca University, Canada's online university. And there I coordinate the accessibility services. I also help with the education and awareness around that. And on my journey to get here, I was working in assistive technology, needs assessment, training, technical support. So I've seen a variety of technology over the decades. And I tell everyone, children, youth, and people that are aging, I said, you just need to find the tool that's best in your toolbox. And these are some of the things that I use, are like a screen reader. I use low tech, like a magnifier or a monocular, and I use a white cane as well. And there's so many other high tech things that I use called assistive technologies, but now we also have another piece of technology that's being introduced into the mix. It's called accessible technology. And this is where it's mainstream technology that has accessibility features built into it. Or the marketplace is going, everyone can use that. And we've seen this in the built environment when it comes to curb cuts, sometimes walking and mobility aids as well. Many people require the use of them because of their individual needs. And so my key and my whole purpose in life is to make sure that we make the world a better place through the use of assistive technology and accessibility. And that includes reducing barriers so that we become equity deserving people and not equity seeking people. And that's all I have for you right now. Come back to the discussion later.
That's the perfect version. Please stay on. Don't go anywhere, Carrie, and we'll invite our other two panelists back. And Len, if you'd like to join, you're welcome to do so. Otherwise, you can learn from the rest of the panel in the way that chooses you. Good. I'm glad you showed up.
Here.
That's lovely. That's wonderful to have you here. So when we're thinking about some of the user aspects, this is a piece that we've been talking about. And I want to share with you that I use assistive technology, and my family does too, in a wide variety of ways. We're going to invite the other two panelists to come back as well, so we can have a joint conversation together. Thanks very much. And we have our last panelist joining us for a second. But I wanted to just pick up on your points. Alison, Era, and Carrie, you talked about that user interface. I think that's a really important piece. I think we've all seen technology that maybe looked like a good idea in the lab, and then when it gets out into the real world, you think to yourself, no, this is not actually going to work or be the best experience for me. I wondered if I could ask each of you in turn a little bit of both, maybe the good and the bad that you've seen on user interface. And Alison, I'll go to you first, and then maybe Karen and Era as well. And Len, I'll get you to jump in if this chimes for you. If not, I'll let you off the hook on this one. So some of the good and bad, some of your experiences with that user interface.
Okay, for myself, I'm sort of jumping into the tech for good arena, which I'm going to talk a lot about. But a good example is, you're correct. There are lots and lots of products out there, and it's really hard to navigate. And that's what Tech for Good helped me with, because they were the experts. So the assistive person that helped me, her name is Sam, she gave me suggestions that I could then research, but she narrowed it down for me. And even though she did, and I'm going to use the example, I have I can't really sort of get it for you. I have a stand for my phone because I have problems holding my phone with my hand because of my MS. And she recommended one, but it was very expensive. So of course, I tried to do more reasonable options, thankfully through Amazon. And I tried about 5 different things. And of course, they all failed miserably. And of course, I did go back to the original one that Sam suggested, and it works amazingly. But again, it's navigating all of that is hard.
as well. Carrie, I just wanted to ask you to share a little bit, I spent a lot of time, I think, educating industry as well as sharing perspectives of end users. Can you give us a little bit of insight into what that experience has been like for you? And what are some of those key messages that you give both industry and end users about that interface?
Well, when it comes to the user interface for accessibility, we're talking about function and information. Right. And so when it comes to function, that's when I talk to the developers, designers, really coming at it from a lived experience, consult with the user. What does the user need? What are they looking for? Not what's possible right now in the world of what I can create or what I can't create, or financial resources or what have you. So for me, it's really about having that discussion with the developers. This is what the web content accessibility guidelines are, for example. This is what the built environment means. This is the accessibility guidelines around building products that people can use who have dexterity challenges, et cetera. So I find myself wondering sometimes, am I the only one that knows this? And why are people who are getting taught this in post-secondary education not getting even a chapter on accessibility and what accessible information, accessible function is? And when it comes to the information piece, that's exactly what some of the presenters and my fellow panelists have talked about already. It's that information. There's so much bombardment with marketing material. And, if another person who's blind comes to me and says, oh, there's this app that will read my documents to me on my iPhone, I'll be like, oh, because really your iPhone is a piece of accessible technology that has it built in. And that's really where we're going, right? So it's having people understand what they have in the palm of their hands and what they can easily get their hands on without getting sucked into all of this marketing stuff, right? And I'm hearing some fantastic resources from my other panelists and other presentations and today, and I'm very, very excited. So.
It's amazing the difference in assistive technology with that smartphone. We'll get to the cost. Glenn, I'm gonna give you a cost question, but I'm going to give you a bit of warning around that later on. Don't worry about it. But Era, I wanted to turn to you. I mean, we've seen such a big development from my grandparents' hearing aids that were such a challenge to now my father's hearing aids, which he seems to actually want to wear, and my hearing aids, which I'm about to go get. We're seeing just a big generational leap in actually matters of years now, because I know of smartphones and the ability to use some of that handheld tech as well. Can you share for us a little bit of your experiences where that evolutionary process has been and what you're seeing end users want?
Yeah, no, I think one of the things that I have seen through my work, the great advantage, and I mentioned before, of like AI and the capability that we can now automate some certain tasks that were abilities that we couldn't do before. And so I think that's really interesting opportunity. But another thing that I wanted to talk about is there's really, when I talk to a lot of users, what I see is two different camps of users. There's the camp that have gone through a hearing loss maybe earlier in life, like myself, and we've gone through many assistive technologies throughout our journey, whether it's through the school system, and we get resources at the academic with the accessibility office that can help us. And then when you get into your adulthood, that's where the gap seems to be missing in terms of who do we go and get access to information and technology. And I also see that also with people who are getting a disability later in life, where it's something new. They don't have that natural touch point as well as I did. And so they're lacking that kind of access to information. So I think it's really critical. But also from a startup point in terms of technology, there's just so much potential. And I go back to some of the points that we've been talking about before about having, like the technology that's not necessarily built for us. And I really want to emphasize that it's really important that we have and educate our startup ecosystem, that we focus on the people who with the need and build it for them first, because then it can start to get into other complications where you start seeing investors influencing the need to go to mass market, and then you're shifting your focus to trying to appeal to everybody. And we know with the disability market, it's a very heterogeneous sector. So there's a lot of needs and and identities that need to be taken account for. So I would say that from my own personal experience, there's a lot of opportunity. It's really, I think this network like this is where we can get together and really start to tackle some of the key challenges that we will see a lot of good new development in Canada.
That is really inspiring. And I really appreciate that conversation around where we have dedicated, let's call it health or medical tech as a category, and then things that we just use that we don't even really think about it. But of course, it's us using it. Every time I turn my iPhone on, I may be just making the font bigger. I'm not necessarily thinking of that as an assistive, but of course, if I take my glasses off, I can't see it at all. Mind you, if I go into the accessibility features, then I have more dedicated flashing and so on. So I think that interface and that fine line is getting even finer as our technologies are starting to normalize. But Carrie and Len, I want to ask you a little bit about money, because this is a piece that I know that folks often have real challenges, particularly if you look at people who perhaps have lifelong disabilities or exceptionalisms where they may be having, real struggles with poverty. And so, funding can be a real issue for a lot of folks. So Carrie, I wanted to ask you, we've talked a little bit before about disability tax credits. Can you share a little bit about your thoughts, what people can do about that? And Len, I'm going to ask you, March of Dimes afterwards has been a core supporter of people getting their hands on technologies. I'm going to ask you afterwards what people can do to help and what some of the programs are. So Carrie, could you just share a little bit about affordability?
For sure. I think that assistive technology is way overpriced. That's my first thought. My second thought is we need to help to create systems and ways of acquiring assistive technology that is more in the realm of helping people. So for example, a universal thing for people with disabilities is the tax credit that you mentioned, the federal tax credit. It would be a fantastic opportunity for people to be able to claim assistive technology on there, use it for assistive technology, but have a pot just for assistive technology. No justification, no needing to have a report or an assessment, right? You've already got the tax credit, so why can't we just use that? Because we know people with disabilities are have a higher unemployment rate, right? Are in the financially marginalized group. And we also know that some of our funding programs are not as accessible as they could be because they're very specific in their criteria and requirements. And their equipment that's on their approved list of what funding sources will buy is also not up to date. So we have funding programs not funding smartphones. We have funding programs not funding data plans. And people with disabilities use data plans all the time for getting around, for opening doors, for calling an elevator, for getting a ride. Checking transit, like whatever it might be, right? We're using technology to do that. And so data plans need to also be more affordable. But why do we have to justify? Is I guess my point. So that's a bit on the funding and how it can be easier if we just start including it in what we're already acquiring as people that have disabilities.
Absolutely, so important that we both understand what can be used for us as people who need and use assistive technologies, but then also figure out how to get it. The amount of red tape is actually extraordinary. And I would personally, and this is just me speaking as an individual, I think it's reprehensible, because what we want people to do is have full and engaged lives. And yeah, we make some of those, let's call it hoops, very complicated to jump through. Len, this is near and dear to your heart, March of Dimes, and has been a long-term supporter of accessibility and inclusion, and also around getting people the things that they need. Can you just share a little bit about your mandate in that area and any pieces that you'd like folks to know?
Well, I wanted to chime in on the interface conversation as well, Laura, to say that, some of the obstacles that we're encountering with regards to government programs and what's funded in some ways is related to the interface question. When a device like a smartphone is not seen as an assistive device, but it has accessibility built into it, and it's not included in government funding programs because it's not seen as an assistive device. I've known Carrie for many years, and one of the first times I had a chance to meet Carrie was at the CNIB when she was on the Techno bus. And I remember some of the devices that were out 30 years ago that you would carry around on a strap over your shoulder and plug it down in the desk in front of you to be able to read materials that you can now do off of your iPhone. I think part of the challenge, and you asked what Martyrdom Canada is doing about this. Well, there's a couple of things. One is we're trying to educate policymakers across Canada because there's a patchwork of programs in this country, and depending on where you live, and Carrie gave some great examples, but also a key consideration is that oftentimes technology is linked to where you are in your life journey. So when you're in school, you get a piece of technology. And in some jurisdictions, when you leave school, they take that technology away from you because it's part of the school system. And there's no next step in terms of how do I get that device back again to support my employment needs. So we are advocating. This is why our national advocacy network that we're building, this will be a front and center issue, helping to educate more Canadians who are interested in this important issue to feel knowledgeable enough to talk with decision makers and government about what we can do to enhance access. And then there's also the discussion with industry. You know, we're working closely with Microsoft and Apple and a number of the major players in technology to understand what's coming in the future. What can we do to engage more people with disabilities in conversations about product design and ensuring that, you know, what's coming to market will meet the needs of an aging population, many of whom senior citizens in our country who are dealing with disability related issues, but do not consider themselves disabled and would not put up their hand to participate in a disability related program because they would think, well, there's people with disabilities who need that more than I do. So we've got to also break down this dichotomy that exists between the disability community and the rest of Canada, because there's a strong connection. Some of us may only be one doctor's appointment away from finding out that I'm now part of the disability community. And there's so many things that we can be doing to begin to enhance and change the conversation that's happening right across Canada at the jurisdictional level, at the policy level, and certainly when it comes to product design and development. I just think that this opportunity of gathering experts like we're doing here today and getting input from our community can be the game changer in the future.
Len, that's really inspiring. And that conversation around how do you self-identify is such an important piece. On the one hand, we want people to identify because we want both the technology to improve. We want normalization of inclusion and accessibility. But on the other hand, you know, we don't want kind of that stigmatization. And so really it's that coming together around good design, that's inclusive design, that I think is helpful. I encourage many of you, and this is the lawyer coming out on me here, you'll forgive me for a second, to make a list and look at what is included for disabilities. And it is a very, very broad and inclusive set of either diagnoses or conditions. And I think we need to make sure that people can see themselves or hear themselves or understand themselves or connect to their well-being and also understand what types of reimbursements are available to them or other opportunities. I'm going to pivot the conversation a little bit. Era, I do want to hear a little bit from you about kind of insurance pieces, but I know that you're leading in corporate ideas around diversity and inclusion being, you know, corporate inclusion and thinking about accessibility in that business lens. Could I pop it over to you to share a little bit of those pieces from your perspective?
Yes, I certainly can. In terms of diversity, inclusion, opportunities, like I mentioned before, like we are dealing with a sector that's very heterogeneous, a lot of people with different needs, and being able to understand those needs in the context, not just on the device itself, but in the environment where those devices are being used, I think it's really important and critical in the development of any product as well. But I'm curious to just chime in on the whole question about the cost and everything, because one of the things that from a startup perspective, what I've noticed is that we need to start to innovate with the business model for developing and distributing assistive technology. One, myself and Laura, you probably can understand this, but hearing aids are really expensive. You're looking at $7,000 for just one or two pairs of hearing aids. And really, when you look at it, the cost itself of a hearing aid is only $150 $50 to make, but there's just such a huge increase. And because we are, particularly in North America, where technologies and capital is very readily available, there is an ability for us to be stuck with those type of price point. But really, when I think WHO has really brought up the point, is that distribution of technology is really an issue, because when you go into other development countries, whether it's remote areas or even just even having access to the top technology itself, is really becoming why the prices are going to be increased when it gets to the end user. So I really think that when we think about diversity and inclusion, we're really thinking about the understanding the individual themselves and how the product fits within their lives and the context of their environment that can really help build and have products that are accessible, but also available as well.
I'm going to ask each of you to do a top takeaway, because this is such an important conversation. And this is leading us into our wrap with Sherry Baker, where we're talking about moving from this discourse into some other points of advocacy. So what I'm going to ask each of you to do, Len, this includes you, is to give us kind of a hit list takeaway. What's really the one or two things that we need to do, and who are you speaking to? So is it government? Is it industry? Is it the public? Is it media? And Len, I'm going to kick it off, if I may, with you first. So what's one or two top takeaways that folks need to know, and who is it that needs to know that?
Well, I think the top thing that people generally in Canada need to know is that technology is a game changer in assisting people to be able to continue to live independently in their homes, to maintain their employment, to have success in school. And we really need to start to change the conversation that's happening around what we're calling assistive or accessible technology. And we saw it in a previous presentation, all the different names that we throw on the devices, the technology that help us to remain independent and active in our lives. I think the sooner we can work on starting to change government perception, and I'm focusing on the funding issue because all the panelists have commented on the cost of technology. So first of all, let's get the cost of technology down to the extent that we can. And then where we do need funding programs to help people do that, make sure that there is consistency in approach and definition across the country so that we're not discriminating for Canadians based on where they happen to live in our country and what's available to them.
Tell me in the chat, do you agree? Let's hear from you in the chat what your top takeaways are. Carrie, may I go over to you next, and then Era and Alison. So Carrie, over to you. What's your top takeaways?
Fantastic. Well, thanks. Because I'm so involved in industry and teaching and research with them, I want to talk to industry because that's who's driving what we're doing, right? Whether in the capitalism around that, et cetera. So developers, designers, people who have product ideas, you need to know that accessibility are the hooks for assistive technology. And so if the hook isn't there, then assistive technology likely won't help someone. So your efforts could go down the tubes. So please do research and be a leader, and you'll be recognized for it. Like many of the organizations represented here today, we're willing to shout out to you as a leader creating accessible information and technology.
And you'll sell more stuff, which is part of the whole thing, right? Like it's not, it's not a genius requirement here. Look at the number of people, look at the people with unmet needs, meet the needs. If I recall, that was capitalism 101. So we're not asking anyone to do anything different. Era, over to you. What's a top takeaway and who are you talking to?
Yeah, no, I think one of the top takeaway is, and this is coming from a personal experience, and it's really understanding the bias and stigma that is associated with the disability market. And once we can sort of focus and bring our programs and policies around helping people to be more confident in this space, I think that's one of the really critical things that we should be looking at, so they can be more open to assistive technology and more open to expressing their needs as well. But the other top takeaway, obviously coming from a startup, obviously I need to add this in, is really advancing technology in this space. I know that the Canadian government is looking to work toward developing more IP and intellectual properties in this space. This is a great opportunity for Canada to capitalize on this opportunity and for assistive technology. This is a sector that we've seen from the numbers and the data that there's an opportunity here. So we should start to see more funding and opportunity to really drive it and bringing more advanced technology to this space that is unique to the Canadian market, but also that can go just worldwide as well.
Absolutely. And that's a core piece that AgeWell tries to support. Thank you so much, Era, for that. Alison, last word over to you.
Okay, so going to summarize a lot in a couple of sentences. So for me, technology really gives myself and gives people a voice and a sense of purpose. And what I love about technology is that it's given me an opportunity to create a community around me, even though I'm isolated and on my own. And the Tech for Good program, which unfortunately I haven't been able to talk a lot about, is so key because it's a mentoring program. I was mentored, which is really important. You have technology, but you need to know how to use it. And with the mentoring that I got from Tech for Good, I was able to build that community, and I've been able to use it to do what I call vision boards. And I know you can access them so you can see what they're all about. So that's my exciting sort of end.
I think that community is really critically important. And we're talking about inclusion and vibrancy. Community is central to that. I get to thank each and every one of you and whisk you off the stage and invite my dear friend, Sherry Baker. Sherry has dedicated her life to advocacy and supporting people who are older and supporting people with different social vulnerabilities and engagements. And she's one of my heroes. Over to you, Sherry. Where do we need to go from here?
Thank you, Laura. Wow. Actually, my real passion is around community and making sure that communities are safe and inclusive and the very best they can be for everyone. And in the last 10 or 15 years, I've been dealing with the older community and elder abuse. I'm the executive director of the nonprofit in BC that does helps to develop a coordinated community response to abuse, neglect, and self-neglect in community. We have 81 communities right now that are being supported by us. However, with that in mind, one of the things that we are very concerned about is that if we can make sure that all individuals, and especially older people, are feeling safe, are not being isolated, are being well housed, or can manage transportation, and can have access to assistive devices, they can stay safely in their homes much longer. And then if they have to go into care, they can be better looked after and their caregivers can be also supported. So that's the kind of work that I've been doing. I also serve as, I'm actually the chair of the TransLink in BC users advisory committee with other people with disabilities. And it was interesting to hear Len say that older adults don't think of themselves as having disabilities, and he's absolutely right. But when I stop to think, I wear a hearing aid, I wear glasses, I have had 3 joint replacements, I've used canes and so on. So I'm right in there, and I'm in my mid-80s. So, and I'm not about to stop anytime soon. But one of the things about AgeWell that has been unique, I think, and is very powerful, and which is why I've been involved with them for so long as their co-chair for the older adult and caregivers advisory committee, is that they support the technologies that are being developed by offering, making sure that the older adults have an opportunity to assess and to look at what is being done and to give some feedback to make sure that the technologies that are being supported and are being developed are actually going to work. As you said, Laura, earlier, it may look good in the lab, but if it's not going to work, it's not going to be of any help to anyone. So we are consulted from the beginning and given the opportunity with all the programs that Alex talked about. There's usually an older adult or a caregiver involved in providing feedback, sometimes more than one of us. So, and having the language that's being used, we talked about that. So it's not, they're not being ageist about the language that they're using. I know that my time is very short, and I was asked to kind of do a call to action. And for me, as I prepared for this and as I listened today, I think the biggest call to action was the National Coalition to develop a blueprint for the national strategy. Because if we have a good, strong national strategy, then we will be able to accomplish all the other things that we've been talking about doing today around having everything evidence-based, which Alex talked about, the equity piece that Michael talked about, the educational piece that Len talked about, the isolation piece that was, and costs, and excuse me, and the the expenses and the knowledge that Len also talked about. We also heard about isolation, that assistive technology for safety, and finding what the tool is very best for you. What a wonderful, wonderful hour and a half we spent today. And I really, really appreciate having the opportunity to be part of this. It's a person-centered supports that allow individuals to live independently for as long as possible is really the key, I think, to what we've been talking about today. So thank you, Laura. I really appreciate the opportunity, and I hope I can continue to do this really exciting work for some time to come. Thank you.
Thank you, Sherry. Thank you all for sharing your expertise, your knowledge, your personal journeys with us. And as we move forward, I can honestly say in 25 years of doing this work, I've never felt more optimistic about it than I do now. Industries catching up, government starting to pay attention, evidence is rolling in, and this World Health Organization report is going to be a great launch pad for our call to action around creating that blueprint for the National Coalition. Thank you all. It's been wonderful to spend this time with you today. You'll get some more information by email, and we hope that you share this great session with all of your colleagues and friends. That's all from us now. Thank you from March of Dimes, CanAge, and overall from Age Well. Take care, everyone. Have a great afternoon.